I'm Sherry Boschert, reporting for Global Medical News Network. It's been 20 years since the founding of the American Society for Mohs Surgery. At the annual meeting, the founding president, Dr. Matthew Goodman, talked to us about how Mohs surgery has developed and what's ahead for the future. Dr. Goodman, one of the people I spoke to at the beginning of this meeting just mentioned to me that he was still surprised how many primary care physicians still don't know what Mohs surgery is. Is that still a problem, and how has that grown over the years?
Actually, that's been a problem over the years, but less so than before. Mohs surgery, when it really began to take off, was in the 1970s. Nobody knew what Mohs surgery was at that time. The specialties that needed to know most about it are the surgical specialties, and it's taken quite a long time, but most surgical specialties, including plastic surgery, head and neck surgery, are well aware of Mohs surgery and its benefits. The area where there still is a lot of educational opportunity is the primary care physicians, who may not really have a good grasp of what Mohs surgery is or what its advantages are for skin cancer. So I would say that we have an opportunity to help them understand, through the data that we have, the benefits of Mohs surgery.
Is there a certifying exam coming up that's of interest to Mohs surgeons?
Aha, the certifying exam. This is a follow-on to what was formed a few years ago called procedural dermatology fellowships. Now the American Board of Dermatology is discussing and possibly going to propose a certifying exam in procedural dermatology. That is controversial because some see that exam as a potentially divisive move that will divide those who have been certified by the exam as being competent from those who have not. And the question, one of the large questions, is who will be deemed qualified to sit for the exam? That very question may be the dividing point and is part of the main controversy for this. We feel, as in this society, that if you're appropriately trained, which can occur in residency or post-residency, that you can be competent to do Mohs surgery in a quality way for the best care of your patients without having done a fellowship or passed a certifying exam. There's nothing against fellowships or against a certifying exam per se. We just would rather not see those as divisive forces.
Well, we'll be following this issue to see how it plays out. Thank you for speaking with us today. Reporting for Global Medical News Network, I'm Sherry Boschert.